Interprofessional collaboration. The World Health Organization defines collaborative practice in healthcare as occurring when multiple health workers from different professional backgrounds provide comprehensive services by working with patients, their families, carers, and communities to deliver the highest quality of care across settings.
Good morning, Mrs. Hernandez. I am Alejandro and I will be attending physician while you are here in the hospital. Together with me is your nurse.
Good morning, Mrs. Hernandez. My name is Joyce and I'm going to be your nurse throughout your stay here in the hospital. I'm going to assist you and help you with your needs. And I'm going to do some assessments, interventions, and also communicate with the team your health status.
Good morning and thank you.
So, Mrs. Hernandez, how are you feeling right now?
Not good. My hips hurt.
Is this right hip?
Yeah, the right hip.
Okay. So, I might just check it for a little bit. All right. So if you're gonna rate your pain 0 to 10, 0 is the lowest and then 10 is the highest. How would you rate your pain?
Around 7.
Around 7. Okay, I guess it's really painful. I will order you pain medication, and your nurse will give it later. So that we are going to do what are we going to do now? Since you are admitted here, I will coordinate with your healthcare team and who will be involved with your care. I'm going for now and leave you with the nurse, and I will come back later together with the rest of the team once we have had our meeting. Okay? All right.
Is there anything that I can do for you before I take your medicine?
No, just give me the medicine and I'll be resting after that.
Okay, I will be right back.
Thank you.
Good morning, everyone. I have called you to coordinate with your plan of care for Mrs. Hernandez. She's a newly admitted client in her rehab unit. She is a 72-year-old widow, lives alone. Prior to her admission on the last November 25, she accidentally double dosed her metformin, as she thought she forgot it. She forgot, and she experienced dizziness, which led to a fall. She was diagnosed with a right hip fracture, went on surgery on the same day. Her past medical history are diabetes, hypothyroidism, and hypertension. She has been on diabetes maintenance for 3 years and blood pressure maintenance for 10 years. Nurse Joyce, what's your assessment with the admission data for the client?
Okay, good morning everyone. My name is Joyce and I'm the assigned nurse for the patient. And Mrs. Hernandez arrived in the unit from Toronto Northern General Hospital via ambulance. And her vital signs upon admission are blood pressure of 112/57, heart rate of 70, respirations of 18, temperature of 36 degrees Celsius, and O2 saturation of 97% on room air. And her weight is 69 kg and she is allergic to penicillin. The patient is continent of bladder and bowel, and she reported that her last bowel movement is prior to the admission. Her ordered laboratory tests are done, which includes the blood test and MRSA swab. So furthermore, I will continue to assess her condition during her stay here in rehab and coordinate to you guys any changes and management that she might need.
Thank you. I would like to hear next is the dietitian.
Good day, I'm Jeanette, the dietitian. As I heard from our client, she has a past medical history of hypertension and diabetes. I'm going to recommend the DASH diet and diabetic diet. Diabetic diet simply means eating the healthiest food in moderate amount and sticking to regular meal time. A healthy eating plan that's naturally rich in nutrients and low in fat and calories like fiber, like fruits, vegetables, and whole grain. The fibers rich moderate how your body digests and help control blood sugar level. And the DASH diet is a lifelong approach to healthy eating that's designed to help prevent the high blood pressure. Encourage reducing the sodium in her diet and a variety of food rich in nutrients that help lower blood pressure such as potassium, calcium, and magnesium. The DASH diet, it reduces blood sugar over time, is a healthy way of eating. It offers health benefits besides just lowering blood pressure. Dutch diet emphasizes also vegetable fruits and low-fat dairy food and moderate amount of whole grains.
One.
Before creating a meal plan for the patient, I'm going to assess the client swallowing ability to check on what consistence of food she needed.
Can you do that? I think I need to call the help of the speech language pathologist to do that assessment.
Well, if you insist, go and ask them.
I know that I'm not familiar with everyone's roles and skills, but from what I know, the SLP usually does the assessment of the swallowing ability of the patient. I'm sorry if it seemed that I don't trust you, but I'm just focused on the client's improvement.
Okay, I understand. Sorry as well for my reaction. However, I just want to let you know that it is under my scope of practice to do swallowing assessment.
Clarifying professional roles can serve several purposes, such as defining each person's responsibilities, ensuring appropriate implementation of each professional's role, optimizing professional scopes of practice, and thereby ensuring efficient patient management. The active management of conflict is an integral part of building positive collegial relationships. Positive collegial relationships result from good communication, mutual acceptance and understanding, use of persuasion rather than coercion, and a balance of reason and emotion when working with others.
To that, I have all the medications that I have already given it to the pharmacist. Based on her medications, is there anything that I need to watch out or contraindicated to be taken together?
Hi everyone, my name is Champa and I'm a pharmacist, and thank you for doctor for coordinating with me the medication of the client. I have here to list, and based on my finding there is no problem with it, and however I need to talk to her about her medication and instruct her as well, since the cause of her fall is an effective sorry.
Repeat it again.
Okay,
Three.
wait, 3, 2,
Saan? Which
One.
part?
Okay, start from me.
Okay.
3, 2, 1, go.
Hi everyone, my name is Chamba and I'm a pharmacist. Thank you for the doctor for coordinating with me the medication of the client. I have here the list, and based on my finding there is no problem with it. However, I need to talk to her about the medications and instruct her as well, since the cause of her fall is an effect of her double dosing her medication, and I want to imply to her the importance of a medication adherence. I would like to talk to her and encourage her to use some tools like a day of the week pill box or a calendar or chart to write down when she takes the medications, and I'll also try to match the action of taking medication with the patient's daily routine. I'm also going to set up a one-on-one meeting with her to understand and address her concern and involve her in making input and recommendations.
It would be nice, Champa. It would be a great help. In addition, in terms of her right hip fracture and undergoing surgery, I also invited here the occupational therapist and physical therapists. Let's start with the physical therapist.
Okay, thank you, Doc. My name is Jonalyn. I'm the physiotherapist. In my part, regarding Mrs. Hernandez, hip fracture can present complication due to being immobilized. And the goal of rehabilitation after hip fracture surgery is to help her begin moving as quickly as possible to avoid the serious complication that can happen with her being immobilized in bed. So I will keep in mind the precaution after her surgery depend on her surgeon's preferences. My goal is to help her gain his range of motion, maximize her strength, walk without a limp, and resume her activities as soon as possible.
Hello everyone, I'm Vicky, the occupational therapist. Our goal here is to be functionally independent of the client as soon as possible. And we help client also by teaching new ways to move safely during recovery and by providing ingenious equipments. So in regards to our client, Mrs. Hernandez, who has a right hip fracture, I will assess first her mental and physical capabilities before I will give her the appropriate devices. So I will teach her also, for example, her activities such as transferring client from bed to wheelchair, and then instructing proper sitting position, and teach how to use assistive devices such as walker. That's all.
Okay, thank you everyone. Now that we have shared our goals and plans of care for our client, we just have to continue to collaborate with each other, change and status as time goes by. Would like to ask all of you that if you have time to visit and drop by to our client, that would be very good.
Yes.
Meeting is adjourned.
Thank you.
Thank you.
Rin,
Hello, Mrs. Hernandez. I'm back. How have you been doing?
oh, I'm feeling better now because of the medication. The pain is a little bit better.
Okay, that is good to hear. I'm here together with some of the healthcare team that is involved with your plan of care. I'm with the pharmacist, the occupational therapist, the physiotherapist, the nurse, and the dietitian earlier was with us in the meeting, but she had to attend with her other clients.
Okay, thank you for visiting me and thank you for looking after me through my recovery.
Our pleasure, Mrs. Hernandez.
You're welcome, Mrs. Fernandez. It's our pleasure to help you with the best that we can. And by the way, I'm the pharmacist and I coordinate the medication with ordered by your doctor. And I also set another visit to you to discuss some of your health, teaching about your medication maintenance.
And I'm the physiotherapist. After lunch, I will be with you to do some assessment and set the therapy appropriate to your strength and improve the mobility.
And I'm the occupational therapist. I will, in addition to that, I will go along with her to reassess your capability to, so that I will plan the activities and exercises that's appropriate for you.
And in the behalf of the dietitian, she will be ordering you the diabetic and DASH diet. She will create a meal plan to coordinate with you if you have preferences as well in terms of meals. Do you have any question for us?
No, I would like to know what time is the lunch.
Lunchtime is at 12:30, and I'm going to assist you to go to the dining room. And do you have any questions or
No,
anything else?
no, I just thank you for everything and I see you soon or later.
Okay, so that's
Okay.
everything for now, Mrs. Hernandez. We will be going now. You can have more rest. If you need some help, just press your call button and the nurse will be here to assist you. Thank you for your time.
Okay, have a great day, guys.
Bye.
Thank you.
Bye.